The most important question that a patient needs answered, and if they're not asking it, I'll ask them, what are your visual goals with this procedure? What would you like to see? What are your hobbies? How tolerant or intolerant are you of glasses? Most people are here to get out of glasses, but maybe their goal is to see at distance because they're an archer or a sharpshooter. Maybe they're a musician and they prioritize their intermediate vision. Although we're delivering vision at all ranges, we like to hone in on what they use their eyes for. Well, education, it's a long road to become a surgeon of any type. I started with an undergraduate degree in biology and a concentration in chemistry from Miami University of Ohio. Applied to and got into Ohio State, which was my first choice because I'm from Columbus and Clintonville, actually just north of campus. After getting my medical degree from Ohio State, went to residency at California Pacific Medical Center in San Francisco. After ophthalmology residency, I did a corneal transplant and cataract and LASIK fellowship at Duke University in North Carolina. And then the last step was to move home over 10 years ago. People trust ReVision to improve their vision because they know they're going to get the latest technology and it's going to be employed and used by highly trained and highly skilled surgeons. And the journey to better vision will be guided by a very warm, welcoming, comforting staff. And so it's kind of a complete experience to their journey from not seeing well or being dependent on glasses and contacts to being free of glasses, and it should be enjoyable, and oftentimes we hear that it is. So the most impactful patients for me that affect me personally are the corneal transplant patients. They're often losing their sight from either an injury or an infection or a corneal dystrophy that's either going to blind them and or maybe take their whole eye. So when you enter that zone, you're entering a journey with the patient. And I feel their lows, I feel their highs. It's so critical and it's of such a delicate nature. The thing that I wish people would maybe ask me or at least come to me for is a second consultation. They reach a no and they're disappointed, you shouldn't just accept that. Maybe get a second opinion, hopefully come to ReVision to see us, and almost in every case we can help you see better without glasses and contacts. One thing I'd like to do in my career that I haven't yet is really drive philanthropic efforts when it comes to eye surgery. That could be underserved communities in the US or abroad. I've done 2 medical missions, one in Honduras, one in Nepal. The one in Nepal was a eye surgical mission, and it was pretty amazing to help restore vision in those that I haven't seen for years. So when I'm not at ReVision, I spend time with my family. My wife and my kids, we live in Columbus. We enjoy the parks in the neighborhoods, nature hikes. We enjoy going to the zoo. When I have some extra time, I like to play golf with my friends that I grew up with here in Columbus. ReVision delivers an outstanding patient experience, I think because we go above and beyond. It's that above and beyond touch. It's calling them by their first name. It's getting enthusiastic at the end of their surgery and saying, "Great job, Bob, great job, Kathy," first name basis, and it's personal. I am very grateful for the job I have to help somebody see better for life. One of the things I love about ophthalmology is it is a high-tech field and it's constantly evolving. So the future is bright for ophthalmology and for anyone with eye care needs.